Food and health. Cranberries. They're not just for holiday dinners anymore. There are now good reasons to enjoy this power-packed fruit year-round. Although best known for helping to prevent urinary tract infections, cranberries, with their abundant phytonutrients, including anthocyanins, may be especially beneficial in a diabetic meal plan. There is also a growing body of evidence that the antioxidants found in cranberries may reduce the risk of heart disease by reducing LDL bad cholesterol, maintaining or improving HDL good cholesterol, and lowering blood pressure. Fresh cranberries, which contain the highest levels of beneficial nutrients, are at their peak from October through December. As cranberries grow wild in the northern regions of the United States, they are readily available in all regions during the fall months and almost always are sold packaged in plastic bags. Choose bags of cranberries with firm, plump, red berries with no signs of leakage. Uncooked cranberries can be kept in the refrigerator about a week. 1 cup of whole, unsweetened berries has only 51 calories and 13 grams of carb, and they are a good source of vitamin C. Fortunately, you can freeze cranberries to use throughout the year. Serving sizes for different forms of cranberries. 1/2 cup fresh. 2 tablespoons dried. 1/2 cup cranberry juice cocktail. 1–1/2 cups light cranberry juice cocktail. Add cranberries to smoothies, salads, chutneys, or muffins. Be sure to look for reduced sugar or sugar-free cranberry products. Fish. The 2010 Dietary Guidelines for Americans recommends eating fish twice a week. Unlike many meats, seafood is low in unhealthy saturated fat and cholesterol. Plus, it's a good source of omega-3 fatty acids, particularly fatty fish such as salmon, mackerel, herring, lake trout, sardines, halibut, and albacore tuna. According to the American Heart Association, omega-3 fatty acids lower the risk of arrhythmias, abnormal heartbeats, which can lead to sudden death. Omega-3s also decrease triglyceride levels, slow the growth rate of atherosclerotic plaque, lower blood pressure, and curb inflammation. Further, ongoing studies are evaluating their effectiveness for decreasing the risk for Alzheimer's disease and dementia. One downside of eating fish is some kinds may contain high levels of mercury, notably shark, swordfish, king mackerel, and tilefish. While children and pregnant women are advised by the U.S. Food and Drug Administration (FDA) to avoid eating these varieties, the benefits of eating fish outweigh the potential risks for middle-aged and older men and women. As long as the amount of fish is eaten within FDA and Environmental Protection Agency guidelines, eating a variety of seafood helps minimize the amount of mercury in your diet. The serving size guideline for seafood is the same for meat and poultry, 3 ounces. Even though fish might be more expensive than other protein sources, preparing it at home rather than ordering it in a restaurant keeps the cost down. Flaxseed. Sometimes good things come in threes, and that's certainly true of flaxseed. 1. It contains alpha-linolenic acid (ALA), which can be converted into omega-3 fatty acids, offering similar benefits of those found in fish. 2. Flaxseed is a good source of lignans, antioxidants that have been shown to help prevent heart disease and cancer, according to the Cleveland Clinic. 3. A 1 tablespoon serving of whole flaxseed contains a respectable 3 grams of fiber, both soluble and insoluble, and just 3 grams of carb, but note that it does have 55 calories. Recent research makes a strong case for including flaxseed in a diabetic diet. The National Institutes of Health states that flaxseed is possibly effective for lowering hemoglobin A1C in people with type 2 diabetes, a measure of average blood sugar levels over 2 to 3 months. In a small study reported in the Journal of Dietary Supplements in 2011, researchers found that when people with type 2 diabetes supplemented their diets with ground flaxseed, fasting blood glucose levels decreased 19.7%, total cholesterol decreased more than 14.3%, triglycerides lowered 1.5%, and low-density LDL bad cholesterol declined 21.8%. In an analysis of 28 scientific studies, researchers conclude flaxseed significantly reduced total and LDL bad cholesterol. Another study found that people who added 30 grams of ground flaxseed to their diets experienced a drop of 15 points in systolic and 8 points in diastolic blood pressure levels. While there are no specific recommendations, most health authorities recommend eating 1 to 2 tablespoons of flaxseed daily, either in whole or ground milled form. Enjoy the nutty flavor seed on cereal, on salads, or mixed into quick breads and smoothies. Garlic. Garlic, the edible bulb from a plant in the lily family, has served as both a medicine and flavoring agent in cooking for thousands of years. It has been used to treat high cholesterol, heart disease, high blood pressure, and cancers. So does it really work? Here is what the current science says, according to the National Institutes of Health. Some evidence indicates consuming garlic can slightly lower blood cholesterol levels for short-term use, but other studies conclude it has no effect. Preliminary research suggests garlic may slow the development of atherosclerosis, a condition that can lead to heart disease or stroke. Evidence suggests garlic may slightly lower blood pressure, especially in people who have high blood pressure. Joanne M. Gallivan, Road, Director of the National Diabetes Education Program at the National Institutes of Health, has this kitchen tip. Garlic has been shown to have many healthful benefits, including lowering the risk for many cancers. But the way you treat it while preparing a dish can enhance its cancer-fighting properties. A recent study showed that letting garlic rest for about 10 minutes before it is used in cooking may enhance its cancer-fighting benefits. Chopping or crushing garlic helps to produce the active compounds that give it the distinct smell and healthful sulfide compounds. But heating it immediately after it is chopped inactivates the cancer-fighting properties. The serving size for fresh garlic is 1 clove, which has 1 gram of carb. It's a great addition to pasta sauces, stir-fries, and many shrimp dishes. Kale. It's no wonder the popularity of this leafy green, non-starchy vegetable has soared in recent years. It's tasty, highly nutritious, and a versatile ingredient in the kitchen. A 1/2 cup serving of cooked kale has only 18 calories and 4 grams of carbohydrate. It contains almost all the important nutrients, from vitamin A to zinc, says Connie Crawley, Road, LD, Nutrition and Health Specialist at the University of Georgia Extension Service. When you go to the farmer's market, there are so many varieties to choose from. You are bound to find one that you like. It can be steamed, sautéed, microwaved, or stir-fried. Like spinach, kale is one of those green leafy veggies associated with a reduced risk of type 2 diabetes. In one meta-analysis of several studies, people who ate the most green leafy vegetables were 14% less likely to develop diabetes than those consuming the least amounts. Kale and spinach contains 2 pigments, lutein and zeaxanthin, that are beneficial for eye health. According to Harvard's School of Public Health, sunlight, cigarette smoke, air pollution, and infections can cause free radicals to form. These two pigments seem to snuff out free radicals before they can harm the eye's sensitive tissues. They also appear to be protective against cataracts. Carolyn Washburn, Extension Assistant Professor at Utah State University, has these tips for selecting, storing, and cooking with kale. You can buy kale year-round. Avoid kale that has wilted, yellowed, or insect-damaged leaves. Smaller bunches will be more tender. Wash kale in a vegetable wash or vinegar and water. Dry it with a paper towel and fold in half for cutting. The spine of kale is often tough, so it is best to remove it. Use kale within 5 days of purchase. The longer you store it, the stronger and more bitter the flavor becomes. Wrap unwashed kale in damp paper towels in a plastic bag, and store in the vegetable crisper.